I was going to bring this up, and you kind of just did on the anomalies. So your special boy Freddy, there, the big gray horse behind you on the poster, you were with him nearly his entire life and thought you knew him inside and out. And then even he had something to teach you unexpected there at the end. So would you go into that a little bit?
Well, he had a few things actually that were surprises, and this is relating to his skeleton only. One of them was rib fractures. Where did they come from? I wasn't expecting rib fractures. He had some very small fractures in the costal cartilages, which I think is relatively easy to do. A horse kick them in the side, or rolling, falling over in the field, that sort of thing. And those structures at the end of the ribs, they're really quite small. But he had an old fracture, and the reason I say it was old, and again, when you're looking at a skeleton, you don't know whether the bony changes, or certainly from a fracture, you don't know whether it happened last year or 10 years ago. There's no real way of telling, apart from the fact that he'd had this rib fracture. It hadn't just fractured, it had moved and overlapped and then refused together. So there was a step change in the rib. And the location was what got me, because the location was just remember it was his 8th or his 9th rib, but relatively high up. So it wasn't like on the bit of the rib cage behind the where your leg is when you're riding. It would be just behind the scapula. So it would have been, and those ribs in that area. So your first 8 ribs, when you look at them in cross section, they're almost like thick blades. They're quite chunky. When you get further back, so by the time you get to your 18th rib, they're a different shape in cross section, but they're also much smaller. But those ribs further, so progressively from 8, 9, 10, they're quite chunky. Then from 10, it really they start to get smaller in diameter. So we're talking about some of the chunkiest, thickest ribs underneath latissimus dorsi, ventral serrate muscle from the shoulder, as well as the cutaneous muscle. So there was quite a lot protecting, and that surprised me. I couldn't think of a time when he would have done that, and I would have thought I would have known. But you just don't know. I mean, there were times when he was lame on his left fore, so maybe that was it. But it's an interesting thing, isn't it? Again, humans can say, oh, I'm in pain. I've got a fractured rib, and we all, well, I've never fractured a rib, fortunately, but you hear that you don't laugh, don't cough, don't sneeze. Those are the things that really hurt, and there's nothing you can do about it. Just let it heal, and that's absolutely fine. We know that with a human. We also know that it would be pretty much the same with the horse, but the difference is they can't tell us I've got a broken rib at the moment. Anyway. The other thing that was quite interesting was an anomaly at the lumbosacral junction. So the lumbosacral junction is the joint between the last lumbar vertebrae and the first sacral vertebrae. This is a key point within the spine because it's basically a hinge joint. And the amount of flexion and extension there is significant because there's very, very little in the thoracic and the lumbar section, and there's none in the sacrum because those 5 vertebrae are fused together. So you could say, in terms of flexion and extension, it's the points within the spine after the neck and after the tail where there's most flexion and extension. Flexion and extension at this joint is key for, I always say, for the fun stuff, the galloping, the jumping, and the collection in dressage. Basically, it's what allows, because the pelvis is fixed onto the sacrum at the sacroiliac joint, flexion and extension at the lumbosacral junction is what allows the back end to tilt relative to the back. It allows the pelvis to tilt. So each time the horse takes a canter or gallop step and reaches both hind legs underneath the body, the pelvis will tilt. The lumbosacral junction is flexing. And then when the hind legs push out behind, or when he flicks his back end away over a fence, that lumbosacral junction extends. So it's a really key point. And you can find the lumbosacral junction in the live horse by running your fingers along the middle of the back and feeling the tops of the spinous processes. And in the lumbar vertebrae, the spinous processes, these bony projections coming out the top of the vertebrae, are pointing forwards towards the head. And in the sacrum, they're pointing backwards. So effectively, you can feel a gap at that point. There's been studies done that have shown that about 2/3 of horses have an anomaly in this area. So sometimes the 6 lumbar vertebrae, instead of pointing forwards like the rest of the lumbar vertebrae, is pointing backwards, and it becomes part of the sacrum.
You
Well,
mean
with
the
Fred,
dorsal process
yes,
of the
yeah,
vertebra? Okay.
of the vertebrae. So there's a little bit of confusion, or can be a bit of confusion, with that 6 lumbar vertebrae. And the interesting thing with Freddy is his was vertical. So basically, instead of having that very clear lumbosacral junction, his sixth one was undecided as to whether it was going to be orientated like the sacrum, or orientated like the lumbar vertebrae. But the thing is, it didn't make any difference to his range of movement. It is just an anomaly. And in human anatomy, they've got books this thick as to what are normal anomalies, findings, for example, with X-rays. So it's a normal anomaly that we know exists, but doesn't necessarily mean that there's any clinical, significance with that. But it is a variation from the norm. And the interesting thing is, I'd felt his lumbosacral junction loads of times, and it was very easy to feel on Freddy. I never suspected that he had this sort of double. So sometimes when that happens with these horses, they get extra movement between L5 and L6, as well as between L6 and S1 in the sacrum. So they almost like have a double joint, a double hinge joint at that point. But it's, yeah, absolutely fascinating. Didn't know it was there.